Patient DM, who is a 42-year-old male with height of 71 inches and 84 kg in weight, presents to the clinic for reading of Mentex TB test, and which was subsequently read as greater than 15 millimeters in duration. The patient's past medical history is significant for latent TB infection and seizure disorder. The patient has gone through chest x-ray, which was a negative, and also has had positive TSD since the induration was greater than 15 millimeters. The patient is currently on medications such as isoniazid, 300 milligrams tablet, 1 tablet by mouth daily, carbamazepine extended release, 300 milligrams tablet, which is taken 2 tablets by mouth twice a day. Also, the patient is on OTC medications such as calcium carbonate 500 milligrams tablet and acetaminophen 325 milligrams in capsules. One of the main problems the patient faces is latent tuberculosis infection. Patient reports to have traveled to India in recent times, and also the patient's physical exam of TSD and induration of greater than 15 millimeters significant for LTBI. The patient has gone to India, which is considered to have prevalent source for active TB infection. The patient has positive TSD but doesn't have any active symptoms, and also has abnormal chest X-ray, which indicates the patient has latent tuberculosis infection, and it demands a treatment. The primary options for LTBI includes isoniazid and or rifampicin and rifampicin. Rifampicin and rifampicin share the interaction with carbamazepine and should not be recommended. Therefore, isoniazid should be continued at the moment. Also, another problem the patient faces is interaction of isoniazid with carbamazepine. The patient currently is prescribed isoniazid on top of anticonvulsant carbamazepine. We should be monitoring the serum concentration of carbamazepine and adjust the dose accordingly, and therefore would not recommend changing the anticonvulsant therapy. However, the dose reduction should be made of carbamazepine to 200 milligrams tablet twice a day for the patient's epilepsy. The patient should be recommended to avoid alcohol use to reduce seizure risk and to reduce the hepatotoxicity risk. The patient should be also recommended to take isoniazid 1 hour before calcium carbonate to avoid absorption issues. And the last problem the patient faces is isoniazid and acetaminophen drug interaction. The patient should be recommended to discontinue Tylenol and switch to ibuprofen in order to reduce hepatotoxicity risk.